Hello, I'm Woori, CEO and founder of Potipayi. Let me introduce our company. So let's begin with some statistics first. Did you know that Korea has the highest suicide rate among the OECD countries? Unfortunately, the suicide rate in Korea is 2.2 times higher than average of OECD countries. And when it comes to the prevalence of depression, Korea is still number one that cannot be surpassed. The situation is even worse now. Post-COVID statistics show 1 in 6 Koreans have thought of suicide, and 1 in 4 are at high risk for depression. The problem is supply is not enough to cover this skyrocketing demand. As a psychiatrist in hospital, I met around 30 patients just in 3 to 4 hours. The average time I can spend with the patient is about 5 to 10 minutes. No time for building rapport or meaningful counseling. And I was not alone. Korea's national health insurance data shows the number of mental health patients grew 8% per year. However, the number of psychiatrists only grew about 3% per year. In other words, the gap between supply and demand widened. The worst part is only 1 in 5 Koreans with mental illness visit hospital. So how are we solving the problem? The fundamental reason of supply and demand imbalance is because the supplies almost 100% depend on human. So it takes average 3 years to decide to see human therapist. Even if you decide, you need to wait a couple of weeks. And finally, when you meet the therapist, you can spend only 5 to 10 minutes on average. If you want more, you need to prepare huge financial burdens. But what if a well-designed software could take the place of a human supply, at least to a certain extent? All 3 barriers to mental health care, psychological, physical, and financial, will be lowered, and we will close the gap between supply and demand. That's why we made Mindling, a digital interactive mental care program. So this is in Korean. It can be helpful. So how does it work? Are any of you familiar with the show Super Nanny? The show shows how Super Nanny spot the child's problematic behavior and find the reason behind it, and advise what the caregivers or kids should do going forward. And she also trained the family to try out the new solution, right? This is exactly how therapy works, and Mindling does the same. Our interactive program helps users to discover their issues and understand where those issues came from and train themselves to overcome them. As everybody has a different mental issue, the program should be tailored as well. Some struggled because they are too perfectionistic, some because of an anger issue, and others because they find it too hard to say no. In psychology, we call these patterns schema. Mindling diagnoses your schema, our test, and provide you the program with your schema. Sometimes we meet stressful life situations such as parenting, and marriage, or getting a new job. So some of our programs are designed to help you cope with this specific situation. Okay, that's all good on paper, you might say, but does it work? Does the program only really help patients without therapist help? The short answer is yes, it does. Our users' CSD score, the clinical measurement score for depression, as you know, show that Mindling alleviated depression by 21% in people with mild symptoms and reduced depression by 36% in people with severe depression. This is significant when you think about the fact that antidepressants reduce depression by around 32% in 6 weeks. Our users were also highly satisfied. 95% of of users said Mindling helps their mental health and they would recommend it to others. So this is what we do here. And if you have any questions or like potential request, let me know. We are open to any kind of inquiries or collaboration. So thank you so much for listening our presentation. Thank you. Bye.